everybody.
Hi there.
Thank you so much for joining us today. So today's talk will be about fibromyalgia. It's a really common condition. And I have to say that in my patients, a very significant percentage have been diagnosed with fibromyalgia before they come to see me. I think it's probably the leading kind of alternate diagnosis that people have. You know, most patients that come to see me, they've seen like 10 doctors.
Yeah.
I'm a doctor. In case you've just tuned in for the first time, I kind of specialize in these vector-borne illnesses with things like Lyme disease and Bartonella and Babesia, Ehrlichia, Anaplasma, and such. And, you know, these are kind of misunderstood infections. They tend to be, you know, indolent and difficult to diagnose. And some of them can cause these kind of deep, non-localizing muscle pains that kind of are the key feature of fibromyalgia. So fibromyalgia has that in addition to other symptoms like sleep disturbance and fatigue and some cognitive issues, and they keep enlarging the symptom list. It keeps growing and growing and growing.
It's like the Lyme checklist.
It kind of is exactly like the Lyme checklist.
Yeah.
And
Sounds like Lyme.
So you had an experience with fibromyalgia. Do you want
Yes.
to care to share that?
Yeah. Sure. I did have an experience with fibromyalgia that was terrible. That was my first Lyme symptom, actually.
Yeah.
And I never had muscle pain before. I mean, aside from just normal, like,
Right.
you know, whatever. I had extreme muscle pain in my arms, and I did not know what was going on at all. So I was told that I had a fibromyalgia presentation, and there was really nothing anybody offered me in the way of treatment. Then 5 months later, I meet this Lyme patient who I didn't really know that was caused by Lyme, tells me to start eating paleo. It reduces my symptoms by like 70%. A few weeks later, I get to you. A month later, it's gone with antibiotics and tetracycline.
Okay, that's great. So there are a couple of important points to expand on just in what you said. One is this anti-inflammatory diet and how good is it? And the other is tetracycline. So I have seen people, you know, really control some aspect of their symptoms with a better and more anti-inflammatory diet. I think it's a great thing. You know what, we should all be on it. I mean, why are we eating this crappy food?
Well, that's true.
You know, when I did the speaking tours throughout Europe, at first I wouldn't eat the eggs there because the yolks were orange. And I thought there was some type of food coloring in the eggs. But they just have like scrawny, like well-exercised kind of chickens that run around all day. And we have like these overfed, you know, chickens that don't move. Or like
I love that visual.
Pre-diabetic
Little
chickens.
skinny European chickens.
No, our metabolic syndrome chickens are basically giving us kind of pale yellow eggs, and they're kind of athletic. You know, well, you know, trim chickens are giving us orange,
without
dark
probably
orange.
as many hormones and
So
gross stuff.
So nutrition is key for most aspects of our well-being. But then also you mentioned about tetracycline versus doxy. So you've taken them both, right?
Correct.
You had doxy before you saw me.
Doxy just made my Lyme angry, as I always say.
Right, and so do you think that tetracycline for your particular case was superior than doxy?
There's no question, hands down. And the other thing I want to tell patients, if they can get a compounded version that can protect their stomach, that was so critical for me. And I'm surprised by how few patients know about it, but it was seriously the best thing I ever did. Yeah,
so doxy, because it's inherently more irritating to the stomach, comes in a stomach-coated one, and tetracycline is a bit easier on the stomach, so they don't have one at CVS, for example. But you can get it specially compounded. It's actually not very expensive at all.
No.
And it's kind of a joy to most people to take it. So the question is, which is better, doxy or tetracycline? So for some patients that have Bartonella, there's a specificity that they have where one of the tetracyclines, whether it's doxy, tetra, or minocycline, seem to work better for that patient. But still, in my experience, both Bartonella and Lyme patients respond better to tetracycline than they do to doxy. Then the question is why? Tetracycline is, you know, there's two studies, one from Stanford and one from Hopkins, and the one from Stanford showed that tetracycline was superior over doxy in the test tube against the spiral forms of Lyme. And then the study from Hopkins showed that it was superior against the persister forms from Lyme. And there's research published that, you know, even when doxy fails, tetracycline can get people out of their Lyme experience. So in the context of prior doxycycline failure, tetracycline success. So in my experience, tetracycline usually does win. There's not, you know, any one treatment to go with, but it's a pretty safe one.
What about all the celebrities in the news
with
fibro? I thought it was really...
Did you hear about Lady Gaga?
Yes.
She was hospitalized?
She was hospitalized on
She must have had a
tour.
very severe case of fibromyalgia. It's so tragic because it usually is one of the easier to treat manifestations of these illnesses.
I know. I tried to get in touch with her through my music business friends, and
What happened?
I don't know if anybody ever actually sent her the copious amounts of information that I forwarded, because I wanted her to get treated and
It's hard,
at least evaluated by somebody like you, because I felt so strongly. By the way, it's not just me. I probably got a dozen emails from doctors, researchers, and educated Lyme patients. Please reach out to her, you know, and so I tried really hard.
It's hard sometimes when you send copious amounts of data. Do you ever feel like people, when they send you too much stuff, you get overwhelmed, don't look at it at all?
Okay,
You know?
so to be fair, I sent a short note, and then I followed with a second email with links, helpful links, you know, probably 5 or 6 things. And
That sounds fair.
I think it sounds fair. I would want that if I was a patient and some stranger is emailing me, I know what's wrong with you, but I'm seeing the best doctors in the world. It's very like, who are you? Well, I'm a person who went through a lot of what you went through, and I hope to save you some pain, because this is needless.
You know what I found interesting? So Lyme and Bartonella and these other kind of vector-borne diseases are so mysterious, and they have their fingers in so many kind of established disease states of unknown etiology, like fibromyalgia, that there almost seems to be like an ownership of your disease state.
Yes.
Like there's a whole community of patients with fibromyalgia, and many of my patients have been a part of that community before they come in, and then they get better. And they've related the experience to me over and over. I can't even tell you how many times, where they've gone back and tried to communicate this like on message boards, and there was resistance, like huge resistance.
Oh yeah,
you know?
People own these diagnoses.
Yeah.
I got a tweet recently from somebody who said, my community, I thought, I have never thought of it like this. Personally, because you have to be willing to get better and think of it in a different way, right? I just feel like some of it is, you know, you get stuck.
I think that, you know, we all have these biases that we, you know, we can't get around, and I don't know, I just think that we're all looking through the universe through our own specific little lens, and that's, you know, and I recognize that I'm looking at it through this, you know, tick-borne and Lyme lens too, so I always have to step outside that, and in my patients, I'm always saying to myself, what else is this? You know, this all can't be Lyme, but you know what? The majority of the times,
nobody gets to you, right? I mean, few get to you without having ruled out so many other things, right?
So vetted,
scanned, they've had spinal taps, they've had surgeries.
Overscanned. It's a pet peeve. So many patients come in with like 5 CAT scans under their belt, when just for the public, I mean, CAT scans equal a few hundred chest X-rays typically, and many of the CAT scans can be replaced by MRIs. You know, some things can't, like CAT scan of the head, let's say, if someone hit their head and they suspect acute bleeding, is superior to an MRI. A CAT scan looking for lung tumors, it's superior than an MRI of the lungs. But for most things, like to look at the organs, look at the kidneys, liver, what have you, you know, for lymph nodes, MRIs are in many ways superior to CAT scans.
Are they more expensive? Is that why people
They're more expensive,
don't get them?
They are.
So insurance doesn't, maybe will be willing to pay for you to get a big dose of radiation, but not a safer MRI.
CAT scans are approved like that, and MRIs, it's a whole approval thing that you have to go through. It's a pain in the butt for doctors and stuff like that.
I don't want to forget, before we go, to just mention Chris Christopherson, because of his long 30-year history with fibromyalgia that also resolved with a couple of weeks or a month of antibiotics, a very simple tetracycline or doxycycline, and the suffering that he went through.
It's hard to think that he went through it for 30 years.
30 years.
And it all went away with a couple of months of antibiotics. It's not, doesn't seem like it's fair, but I do think that's what happens. Don't you think that most patients with these illnesses, they never get evaluated for anything other than, like they always say, well, this, you know, like the doctors tell them, this is mysterious. We don't have the answer. Here's your antidepressant and your sleep medicine and your, you know, pain reliever.
And get some therapy. Get some therapy because you're probably depressed.
That's all. I just have a big problem with Band-Aids, you know, especially Band-Aids that don't work well. These medicines don't work well anyway, and they're prescribed in combination for literally decades. And, you know, it makes this risk-benefit analysis very much in favor of exploring these other possible causes. Again, not saying that vector-borne disease causes every case of fibromyalgia or every case of any of these illnesses that we speak about on these tapes, but the link with fibromyalgia is so strong, so strong. It's one of the strongest links, and it's one of the easiest to solve.
It
So
is.
from that aspect, I am so encouraging of people with fibromyalgia to look into this, not with me, not looking for business, just go to any doctor affiliated with ILADS.
ILADS is ILADS.org. These doctors are specifically trained to look for these specific kinds of infections and evaluate them, because we should mention the testing, the regular testing that you're going to get from just going to your pediatrician or your internist is extremely poor.
There's a lot of interlab heterogeneity, which means that you can send the same blood test, and this has been shown in studies, same patient, same blood test, send it out to 5 different labs, get 5
You've done
different
this,
answers.
by the way, which is super interesting.
I did this when I first opened up, and I was like, how am I going to do this field? You know, these lab tests, you can't rely on it. So what we end up doing is trying to cross-reference data from a lot of different viewpoints to see if it all matches up. And the majority of the labs that I order at the beginning are all like in-network labs, like Quest or LabCorp or BioReference.
Yeah.
Then we just have a couple of send-outs, very limited in terms of the send-outs. But we get tons of information from in-network labs. There are all these other markers besides just antibody tests. There are behind-the-scenes markers. Maybe we should do a video on that, you know?
Yeah, we should do
definitely.
it. And I think I used, well, first of all, I had Lyme and a bullseye, so I had a little bit of a different situation than a lot of patients that get to you that have no recollection of a tick bite, but Stony Brook is a good lab, and I think insurance covers it.
Yep.
And I know you mentioned Bartonella for a second, and I like Galaxy Labs
yeah, of course.
so much for Bartonella.
We love Galaxy, very smart people.
They're very smart, and they have a really superior test.
They're the best.
Yeah, they're
I
the
think
gold
so.
standard.
I do think they're the best, yeah.
Yeah, so I feel like unless you're getting tested at these labs and then getting a clinical evaluation from a doctor like you who does this, you are not properly ruling out Lyme. So
Just to say we have no financial relationship with those
with
labs.
anybody. We're losing money here. Let's face it.
So
we got nothing.
no, but if you say that you think that something is a good place, you have to say.
Absolutely. We ain't making a dollar on this, but it's just really this is in service of helping you and get to the right diagnosis. I went 5 months like floundering doctor to doctor, and that was with a bullseye and with a known bite and a big thing on my shoulder. So
your story is crazy. I mean, seriously.
My story is crazy.
It's crazy because it's like in their face, you know.
It was
so
right in their
obvious.
face, right? And let's face it, I'm not an undemanding, unquestioning patient.
What do you mean?
No, I mean I went, and nobody would agree that I still had Lyme.
Right, you aggressively pursued your health, and you still had roadblocks, is what you're saying.
Yeah, and guess who diagnosed me? Google.
Yeah.
So there we go. Thank you to Dr. Joe Barascano for your terrific checklist.
Thanks, Joe.
Yeah, thanks so much.
Good guy.
All right, well, thank you guys for watching and being with us.
Thank you.